Good afternoon, everyone, and welcome to the Policy Modelling for Health webinar series. My name is Alison Caldecott, and I'm the Communication Manager for Policy Modelling for Health based in Public Health at the University of Glasgow. For those of you who don't know, Policy Modelling for Health is funded by the UK Research and Innovation and is part of a £35 million population health improvement network. This supports innovative research aimed at tackling the wider determinants of health and reducing health inequalities. Our work within Policy Modelling for Health is focused on developing advanced computational models to help policymakers explore the likely effects of different policy choices on health outcomes across society. This webinar series offers insight to our work and is presented by members of the research team. Each talk is designed to be easily understood for a general audience, but there are opportunities for you to ask questions, and there are recordings of each of our events available on our website. So now I am delighted to introduce our speaker for today, Dr. David Sonnewald. David is a senior researcher at the Dynamic Modelling Work Package, and he's based at the Centre for Microsimulation and Policy Analysis based at the University of Essex. David is in today's webinar will be introducing us to SimPaths, a life course dynamic microsimulation model. If you have any questions, please feel free to submit these at any time through the Q&A tab that you'll find at the bottom of your screen. We will come to as many of these as possible at the end of the presentation. David, the floor is yours.
Thank you, Alison. Since introductions have already been made, I'll dive right in. Okay, sorry. As I understand that not everybody here is familiar with the family of models to which SimPaths belong, I will first start by introducing what microsimulation is. Then I will get into the details of SimPaths and to its applications, both to, of course, policy modeling for health, but also academic research. So what is microsimulation? It is a methodology that uses data at micro level. That means persons, households, but also firms, to run simulations of some sort within a specific context or economy, for example, a country. In practice, most of the time, these simulations regard the effect that public policies or other social or economic changes have on an output of interest. So they're used to answer questions like what is the effects, the impact of a certain reform or other permutation of the status quo on some outputs of interest. Microsimulation models are run normally on surveys or administrative data, depending on the availability, and are built using programming languages that serve as the backbone of the infrastructure for the simulation. The main distinction in the microsimulation world is between static and dynamic models. The primary source of divergence between these two types of models is their scope. So static models try to capture a fixed moment in time, while on the contrary, dynamic microsimulation models show how a population evolves over time. And from this, say, almost ontological difference stems all the others. So if we take again the example of a policy, we know that in reality, agents adapt their behavior in response to a policy, right? However, by their nature, static models do not account for behavior responses. So there is absolutely no randomness in the effects that the policy has on any output of interest. And so static models measure what's called the day after effect. So it's a purely mechanical effect, as if the reform was implemented overnight. On the contrary, dynamic models do the exact opposite. So as they try to see how a population evolves over time, they do account for behavior responses, and in particular, they use econometric models to define how the population evolves over time, how changes occur between states. So the focus of static model is normally one single element of the economy. So, for example, the classical static microsimulation model is the one for a tax benefit system of one country. On the contrary, dynamic models try to model all the events that occur in a life course. So with this distinction in mind, let me finally introduce SimPaths. So SimPaths UK is a dynamic microsimulation model for life course events in the UK. In terms of inputs, it combines data from Understanding Society and the Wealth and Asset Survey with the outputs from UKMod. UKMod is a static tax benefit microsimulation model for the UK. In practice, it returns for all households the tax due and, of course, the net disposable income. So by combining these three sources, we obtain an exhaustive initial population that serves as input for the model. To project this input, this starting population over time, there are a number of interconnected modules that define the life course events and that are built in Java using pre-estimated transition probabilities that are also estimated on the UK HLS data. When we talk about projecting a population over time, it essentially means to look at the evolution of a number of attributes that we call state variables. So here I have summarized the all the state variables in SimPaths that, as you can see, are organized in 5 main blocks. So we have the socio-demographics like age, sex, education, etc. We have family composition and organization. We have work and income, health, both psychological and mental. And then I have highlighted in a different color wealth, just because this is a module that is currently under development. So it's not in SimPaths yet, but it will be in SimPaths soon. This image summarizes the sequence of events in 1 year of the model simulation. So we start with the initial population at the beginning of the first year. All individuals go through these events in this specific order. So first, they are all aged by 1 year. For young people that are old enough to quit their parents' house, they do so. Then the model attributes education levels, health status, and then it determines whether individuals enter or exit a partnership if they have children. Then it assesses the hours of care provision and receipt. While in terms of monetary resources, it first assesses the assets. Then through the labor module, it determines the labor supply and the corresponding labor income. from which, by subtracting the taxes, we obtain the disposable income, which is finally used to estimate consumption. Finally, the mental health is reassessed again at the end of the events of the simulation based on the financial situation. As you can see, there are some alignments at some points in the processes. Essentially, these alignments are to guarantee that the simulation outputs are realistic. So what we do in practice is that we impose the projections from the ONS on a specific process, for example, aging, to guarantee that the actual outputs correspond with the expected ones. Now, assuming that all this was clear, I hope it was, let me give you a bit of more general background on SimPaths. So as was already mentioned, SimPath is fully developed at the Center for Microsimulation and Policy Analysis at the University of Essex, with contributions from a team that is based at the University of Glasgow. In this context, I focused on the UK version of SimPaths, which is also the main one and original one. But in truth, SimPath is a family of models, which includes, besides the UK variant, also 7 other countries that are Germany, Greece, Hungary, Italy, Spain, and Sweden. And for this reason, SimPaths has a wide applicability, and it's used in multiple projects, including, of course, policy modeling for health, but we use it as well for academic research. I think that one of the main reasons for the wide usability of SimPath is that it is fully open source. So if you go on simpaths.org, you should still be seeing my screen. Yes, you land on the SimPaths website. Okay, so SimPaths itself, so the model, lives, so to say, on a GitHub repository, which is accessible directly from the landing page of the site. So if you scroll down here, access the code on GitHub. I'm going to open it on a different tab. You get to the SimPaths repository, from which you can either clone it or download as a zipped folder. Now, I understand this can look a bit daunting, especially if you've never used GitHub before. But the whole idea of the open source is that everything is thoroughly documented, and it is conceived for being used from scratch from a user who has no previous knowledge, neither of the model or anything else related to it. So, for example, if we look at the repo, it has many folders and files. So if I open a random one, I understand this could look a bit overwhelming. But if we go back on the website under documentation, we scroll down to the repository guide. Everything is explained in detail, how the repository is structured. And also there is a focus on the core components of the repository. Now, I would love to show all the website in detail, but I'm afraid due to time constraints, I won't be able to do so. So let me just point you to the main sections of the website. So here we are already on the documentation page, which is designed to get to start to use the model from scratch. So we have a getting started section with also video tutorials that is conceived for the setup. Then there is a user guide that is designed to start running the model. And then we also have a more advanced, so to say, section, which is called developer guide, that is for people that actively contribute to SimPaths code. Then there is a model section, which describes in detail the model, essentially what I've just presented in the image earlier, but of course, much more in detail. So if you go on the simulated modules, for example, you have that all modules are elaborated thoroughly and are explained how they work and how the corresponding code is written in Java. Then we have a validation section where we explain how we validate the outputs of our model. In research, we list all the publications and working papers that use SimPaths. And then, of course, we have a page where we acknowledge all our current and past funders. Again, if you feel a bit lost, there is a search tab where you can look for whatever you're searching. So, for example, suppose that I need some information on the input data. I can type input, and I have directly a number of results. I can click on them and get directly to the corresponding page. So let me get back to my slides. That should be back on your screen as well. And let me get to SimPaths applications, starting with policy modeling for health, which I guess among the application is probably the one with which the majority of the audience is familiar. So the Essex team actually constitutes a work package within the policy modeling for health. So we are work package 3, which is in charge of model development. In fact, the name of the work package is dynamic modeling. So what that does that mean? Essentially, we do everything that is related to, of course, developing the model, which means maintenance, updates, but also potentially the addition of new modules that serve any research question within the context of policy modeling for health. Aside from this main task, we also support other work packages that use SimPaths for their research questions. For example, now there is an interest in the effects of potential policies that target young people that are categorized as NEET, which is not in employment, education, or training. So what we do here, for example, is we help to translate these policies into the model, which means like, where do we have to add a chunk of code, or what parameter do we have to tweak, etc., etc. Then aside from projects like policy modeling for health, of course, there are also others in which SimPath is used. We also use SimPath for academic research. So I decided to conclude this brief presentation by presenting a very brief and simple example of SimPaths used in academic research. So there is this paper we're working on, which tries to answer the question of what are the effects of changes in fertility and mortality rates on the receipt and provision of social care in the UK. It's a very basic analysis. So we take our principal baseline scenario, and we run SimPaths for 50 years for 2020 and to 2070. And then we compare the outputs with the same simulation, so for the same years, but with 4 different variants where we have changed the projections on fertility. So we have a high and low fertility scenarios, and life expectancy. So we have a high and low life expectancy scenario. This is still very much work in progress, but let me show briefly the some preliminary results. So this is the evolution of the number of people in need of care in the UK. The scenarios here are identified by the first letter of the acronym. So high HPP stands for high fertility rate, L low, and P is just the principal scenario. And not surprisingly here, we see that even if the number of newborns increases, the overall amount of people that require care doesn't change. But on the contrary, things change when we look at the changes in life expectancy. So here the letter to look at is the middle one. So PHP is the high life expectancy scenario. PLP low, and PP is always the principal. And as a matter of fact, here we do observe a gap between the high and low fertility, life expectancy scenarios. As I said, this is a very basic, simple application of SimPaths. Of course, it can do much more complex stuff, but it was just to give a taste of what SimPaths can do in terms of analysis. So I think I can stop here. I should be perfectly on time. I will just before concluding acknowledge our funders, and of course thank you for listening. I'm of course very happy to take the all the questions in the Q&A chat box, but also if you want to reach out at a later stage, this is my email address, and please visit simpaths.org and send us your comments or feedback. Everything is most welcome. Thanks again.
David, that was excellent. Thank you very much indeed. An exciting model with great opportunities and an excellent looking website. So that's something for all of us to explore. As David said, we now have opportunities for some questions. If you haven't submitted those already, please use the little Q&A tab at the bottom of your screen, and we'll come to as many as time allows. But now, David, for your first question, how does a policy simulation work in practice in SimPaths?
Okay, just unmuting myself. So that's an excellent question, and the short answer is depends on what type of simulation, what type of policy is being simulated. But we can say that generally speaking, there are 3 main channels through which a policy can be simulated. So the first one, suppose, is a policy that generates an immediate change on the initial population. So in that case, the way to carry it out is simply to modify directly and manually the initial population. So, for example, imagine a policy that increases the education level of a certain group. We can go to that group and manually change the education level for that group in the initial population. The second channel, which regards more policies that have an effect through time, it would be to change the transition probabilities between the states. And that would be carried out by altering the regression estimates in the regression files. And the third channel, which is for more complex policies, is to add parts of code to the code base. And of course, this is, as I said, for more complex policies, because it means that you need to change the way the modules currently work. Of course, there is a fourth channel, so to say, which is a combination of the three, but say that the main ones are these three. Yeah.
Okay, if I could maybe get you to stop sharing your screen so everybody can
Yeah.
see you in full
Sorry,
glory.
yeah, absolutely.
We've got a lot of hot and fast questions. One suggesting here, there, with apologies if they missed it, how adaptable is the model if one wanted to include different modules?
Yeah, just give me a sec because I can't.
Oh, yes.
Sharing. I have share setting has remove toolbar, but I can't see. It's weird. It asked me to share again, but I can't stop sharing.
Oh, well, in that case, we'll just go with what we've got. Everybody can still see us, so that's fine.
Okay,
So the
that.
second question was, how adaptable is the model if someone wanted to include different modules?
The model is quite adaptable, theoretically speaking. So modules can be added or removed. Of course, they are intertwined, so there is an interdependence among modules, which means that, of course, if we add a module, we must make sure that its integration, its interconnection with other modules is it works smoothly. But from a pure theoretical perspective, it is definitely possible.
Okie doke. Another question relates to whether or not the microsimulation scripts can run without using Java, say R or Python on their own.
The short answer is yes. So we have created some executables that work without needing Java. So it is possible. Of course, having access to the code gives the full potential of SimPath, in the sense that if you want to add something, etc., you can tweak the code, but you can use it also without it.
Okie doke. So this one's relating to the new smoke-free generation policy in the UK. And the question is asking whether or not could the micro simulate the new smoke-free generation policy in the UK on smoking rates to reach the tobacco endgame scenario? Could it show that it was achievable?
That's an interesting question. I would say that, so I must admit I don't know the detail of the policy, but generally speaking, and that's a broader answer. In SimPath, you can simulate whatever implies change of the parameters and the modules of the model. So if, of course, if this implies something that it is not in the model, either it is you can add it if it can be integrated or not.
Okie doke, great. So this one comes from Paula, and Paula wants to know whether or not this can be used at a more regional level. Would that simply be dependent on which survey data was being used?
That's another thing we've been sort of working on, in the sense that there is we acknowledge that there is great interest on that. At the moment, the model is mostly designed to run at the UK level, which means that you can run analysis at the regional level by subsample the population at the first stage. But it is, since the source data are sampled at the national level, results are not the best for regional analysis. That being said, you can run analysis at national level and that look at the result just for the region. That would be, at the moment, the most effective way to run regional analysis.
Okie doke. So this question is about whether or not SimPaths could be used for both simple and more complex, e.g. multi-tiered type policy evaluations, or is it more suited to that one sort of simpler analysis?
Sorry, can you repeat?
So could SimPaths be used for both a simple and more complex, so something that was multi-tiered, had various policy evaluations, or is it really suited to answering a simple kind of question?
No, not necessarily. I think it can be used for a more complex and multiple policies at the same time. It can be done definitely. It just probably requires a more complex tweak of the current status of the model. So for simple analysis, of course, you can just change, for example, the example I showed, you just change some projections, some alignments, values, or some parameters in the model. Of course, if you want to study something more complex, probably you have to integrate it through a change in the code.
Okay, we've got time for a couple of more questions. So, one is saying here, and I'm not sure whether we'll be able to answer this, but has SimPaths been used to inform any policy decisions that could be shared with us?
Um, I'm, to be honest, I'm not aware if if there has been so far a direct use of CeMPA for a policy decision. I hope it will in the future. So of course, the goal is that one. But so far, I really can't say.
Okie doke. And Leanna wanted to know, how did you select your key variables and on which combinations have proved most impactful on modelling outcomes?
So there is a mix of availability and interest. So of course we have the availability side is that we select the variables that we have available from our source data, and then in terms of personal choice, we keep those that normally are of interest for studying the um, any policy. But as said, this is rather flexible. So if there is a variable that it's not by default there, but it could be useful for a certain study and it is available on the source data, it can be added on demand.
Okie doke. And another question is looking at asking, how do we really get these microsims and similar models to be used more to change the system? Um, I think that's maybe part of the remit of policy modelling for health. We are making sure that people are aware of these models and see the advantages and the values of them. But are you aware of anything else that's happening in terms? I mean, the website development itself makes it much more accessible and available to people.
So, as I mentioned during the presentation, we've been really investing a lot of time and effort to make this the most accessible as possible. The website, I think, is the main showcase, but we also have done video tutorials, and we try to divulgate this model as much as possible. Then I understand it can look a bit daunting at first sight, so it's a lot of material, but the idea is really to reach the average user.
Okie doke. And another attendee's asked, how difficult would it be to adapt the model to a different country context? Would AI be a good option for such adaptation?
Well, I listed it before. We the model is actually available for. I mean, it is already available for 5 countries and will be available soon for 8. So there is already an adaptation of the model to different countries. I must say that once the initial fixed cost of of developing the main structure is done, it is sort, I wouldn't say easy, because of course every country has its own characteristics and features, but it's easier to add it for a new country. As for the AI, yeah, I mean, we do use, of course, AI extensively as a support for, especially for the coding part.
Okay, and our final question for today is around about what the outputs of the simulation actually look like and how they can be used.
Yeah, so at the moment, when you run the model, the outputs that it delivers is a set of Excel files. There are three that are essentially the three data sets with individuals, houses, and benefit units, with all the state variables. And then we have a number of Excel files with some aggregate statistics. So at this stage, this is the output that the model delivers. So it's quite, say, raw, but it can be used for any use. So any user can take it and then plot graphs, generate tables with any software they prefer.
Excellent. Okie doke. Well, that concludes our Q&A for this afternoon. I would like to thank everybody for joining us for today's webinar and for all your questions. A full recording of this will be issued to all attendees and will be available on our Policy Modelling for Health website next week. Please feel free to share this with colleagues who were unable to join us today. Details of our next lunchtime webinar will be available on our Zoom hub and promoted across our socials. So it remains for me to say thank you again to David and to all of you for joining us and wish you a good afternoon. Thank you very much.
Thanks a lot.